We are live. All right, so welcome everybody. It's Kyle Stanley here. I'm here with my good friend, Ziv Simon, the creator of Surgical Master. And before we get started and I have Ziv introduce myself, I'd just like to say that Ziv and I have been friends for many years. He was nice enough to really be a mentor of mine early on when I got out of school. I remember we had a lunch in Beverly Hills. I think I was just out of residency, and you gave me some advice. And one of the biggest advices that you gave me was, you need to do guided surgery, Kyle. If you're going to be doing implants and you're going to be practicing in Southern California, in Beverly Hills, you need to do guided surgery. And I had done some cases, but I wasn't doing them on every case. And it's funny how much of a disciple of guided surgery I have become. So early on, I just have to thank you, Ziv, for giving me that advice. But for those that don't know you, why don't you give a little introduction?
Excellent. Great to be here, Kyle. Thank you for having me. And, my name is Ziv Simon. I'm basically just a regular guy from Israel and did my training back in Israel and also at the University of Toronto, Canada. And then moved here about 20 years ago. Started straight in Beverly Hills. Started kind of from the top, but, needed to work my way up. And I always felt that in order to be successful, you need to do high quality work. And that was really the only thing, but I found out that's just part of the puzzle. A lot of it is psychology and mindset and inner game principles. And over the years, I've been a student of that, and through self-development and learning constantly, I found out that it's possible to be successful if you surround yourself with good people like yourself, Kyle. Although we didn't graduate the same year, I see us as equals, and our goal in this world, one of our goals, is to promote dentistry and do high quality work and help our fellow dentists. That's really my mission.
Yeah, you've been great in, I'm a specialist from another country, but in the United States, I'm a GP, and you've been really, I think, one of the leaders of empowering general practitioners to do good quality work. And, it seems weird from a business standpoint, right? Like, you're a specialist. These are people that would refer to you. However, you have taken it on and said, you know what? I know that you aren't going to refer everything to me, and you may still refer some to me. But if you're going to do it, let's make sure you're doing it well. Let's make sure you're not going to get in trouble. Let's make sure your patients are going to be happy. And so, from the GP world to the specialist world, I want to say thank you for that and everything you've done with Surgical Master. So the topic for today is mental health. And I'll give a little intro, is that I have a course called Light Side, which is an online course that incorporates recorded video and live meetings. It's focused around mindfulness, around stress reduction, around burnout. And in our last course, you joined, and I was like, Ziv Simon is joining my course. I was just so surprised. But why would you, someone who, from the outside, everybody would say is successful, you have a beautiful family, you have a successful practice, why would someone like you, someone at your level, let's say, join a course about stress in dentistry?
It's a great question. That's a great question. So to me, the answer is obvious. I constantly learn to up my game. I never see myself as a person that has been there and done that, and I'm set and I know everything. I actually know very little. And I kind of pride myself in specializing in the psychology of dentistry and psychology versus patients, or vis-a-vis patients, but also vis-a-vis dentists that I work with. Psychology, communication, which is basically the same thing. So when I saw your offering, I felt like, I'd like to learn from Kyle, because what you presented in the, not just the marketing, but also in talking to you and knowing you for many years, is transparency. So what may look glamorous on the outside may be actually sometimes pretty dark on the inside. I also suffered the loss of a family member, a cousin, due to suicide. He was a successful dentist on the outside. So if you think about it, you can't always judge a book by its cover, and there's a lot to discover internally. And that's really why I joined. I feel that I'm pretty well balanced, but I have my own stresses, and I wanted to see what another leader like you can offer me, because I want to be better than what I am right now.
Yeah, I love that constant growth. And, we talk about that in the course with the Dunning-Kruger effect and going through your valley of despair and always being on that constant slope of enlightenment, right? You're never really done. You never really know everything. And I think hearing from someone like you, I know very little, I think was something that I had to learn the hard way, because I came out of school saying, I know everything. I know everything. I had the best mentors in the world. I know everything. And I had to go through that very dark place in order to realize just how vast the the knowledge base is for dentistry. And like you said, it's not only the clinical knowledge base, right? It is that communication. And so many of the problems that I had that put me through a dark time was those communication problems. And we don't focus on that in dentistry. Everything is focused on doing a better implant, doing a better crown, getting a better shade match, and when I think back about the stresses that I had, not a lot of it was based on that, right? Most of it was based on the communication with the patient, the communication with my team members, the communication with my family, with my colleagues. And that, I think, is what more doctors need to learn.
I agree.
So for you in your career, and you've been practicing for a while, what were some of the biggest stressors for you?
Okay, so a lot of stressors and a lot of things that now I'm looking back and thinking and thinking to myself now, what was I thinking? Why was I behaving a certain way? Why did I talk a certain way? Why did I have a certain mindset? Looking back, and I'm seeing myself as somebody who is constantly developing. I don't feel that I'm even the same person I was a month ago. So the biggest stressors that a dentist would face, including myself, are number one, financial, because you got to make it happen. It's a competitive environment. There's cutthroat. You mentioned the issue of referrals. Why am I teaching dentist, where it's like kind of cannibalizing my own business? By the way, quite the opposite. It tripled
Sure.
my business by providing knowledge, but that's probably a separate discussion. So financial stressors are huge. We dentists are perceived as rich people and successful people, which we are. We're in the top 1% in the world.
Right.
But what a lot of people don't realize is the tremendous expenses that we have, the huge overhead. A lot of dentists operate at an 85% overhead. It's huge. So we constantly try to reduce that. That's one aspect. The other aspect is being a business owner and being an employer, and especially in California, there are stresses on that level in let's call it the HR department.
Oh, yeah.
And lastly, last but not least, and that's the third stressor, is dealing with patients. So dealing with patients that are in pain, that are about to have tremendous expenses. So, our patients have their own stressors.
Yeah.
And when treatments get complicated or unsuccessful, that can affect the dentist. So these are the three ones. And I'm just like anybody else: finances, HR stuff, and patient related stressors. So I have the same ones, and still until today, it never changed. I just have better tools to deal with them.
Mm-hmm. And I've had this conversation with so many people by mentoring and people in the course, and It's so funny how those three are the top three for almost anybody, whether they're 1 year out of school, 40 years out of school, whether they're in Europe or Australia or South America or Canada, US. It's so interesting. I think maybe the only difference in the US is that we also have the additional school loans that many of our, our colleagues from international countries don't have. But yeah, those HR communication aspects with staff members, and especially in like you said, in California, places that are more litigious, I would say. And the biggest one for me was probably number 3 on your list. Don't get me wrong, I have hundreds of thousands of dollars in debt, millions of dollars in debt from going to one of the most expensive dental schools in the world. But for me, it was definitely the complications and how to deal with that. And that was really so difficult on my ego, because I came out of school, I had these great mentors, I had, some of the best training I felt like I could have. I was doing top of the line work. I was doing guided surgery, and I was using good implants, and I was using the best labs and doing all the right protocols and everything research based, and things still failed. And I think I had, and I go over this in the course, but I had overpromised and under-delivered. And I had to learn that the hard way. And I've talked to you about this privately. I mean, we've had conversations with patients that we've worked on together, or that I've referred to you, or you've referred to me, or whatever. And I feel like you've gotten to a point where you really have these good communication tools. Is that something you just learned over time? Did you learn it from other mentors? Can you expand on that?
100%. You hit it on the nail. Communication. Good communication is the key to success in life, in period, business life, personal communication.
Totally agree.
By the way, I fail in communication all the time. Okay, just ask my wife. We all fail. We all fail, but we always have to strive to improve. And no, I was not born a natural communicator. I learned it. I can tell you now, mostly from books. I'm an avid reader. I read at least a book every 2 weeks minimum. And I constantly read and improve, not just about communication, but in general. And a lot can be learned. It also comes with a little bit of maturity. You mentioned the word ego. We all have the ego. In some ways, it's healthy, it drives us forward. What's important to remember, and I think that's a great lesson for all of us at any stage where we're at. Nobody's going to die. Nobody's going to die today. The worst complication that you have in your general practice, even my surgical practice, nobody is dying. That's important to remember that.
Yeah.
Your implant may fail, your crown may break, your patient may get upset, but we're not killing people.
Yeah.
Number 2, the difference, and that's something that took me probably 20 years to figure out. The difference between successful dentists and unsuccessful dentists is not their skills, not their looks, not even the way they communicate, it's their mindset. And successful dentists, when you mentioned complications, which was the hardest part for you, successful dentists, successful doctors have a different mindset in regards to complications. They see complications as the inevitable things that happen when you practice. It's just inevitable. It's part of what you do. It's like every day, every week, all the time. And that's how I see it. Now, unsuccessful dentists have a narrow mindset. They feel that if a complication happens, they will get sued, they will lose everything they have. They go into this very dangerous loop in their head. It's very hard to get out of it. While this is actually only in their head, it's not even true. So that's a very important distinction. And it takes some time to get into that, but it's just a matter of changing mindset and learning about that. The one book that comes to mind is the book Mindset by Carol Dweck. That's the
Yeah,
number one
she's
book
great.
that I recommend everybody read this book. Let your kids read this book. Tell your kids about this book. It's basically the difference between a growth mindset and a narrow mindset, and that's life changing, and that transcends to all the stressors we talked about.
Yeah. Yeah. And, so one of the topics that we go over in the course is that triangle of blame. And that was one thing that really changed my mindset, because I originally thought that there were two people to blame, right? I did something wrong or the patient did something wrong. And then I realized, I look back on some of my complication cases and I didn't do anything wrong. And from what I know and what I talk to the patient, especially patients that I really trust, they didn't do anything wrong either, but it still failed. And we have all of these complications that are just part of one human treating another human, two beings that are imperfect and trying to get a perfect outcome. And, we have all these physics and biology and things that we can't control. And so once I was able to really understand that triangle of blame, I was able to communicate it better with the patients. And like you said, it all goes back to communication. So I had to change my mindset about the complications. Then I had to communicate that mindset to my patients and make them understand it. And something that, we talked about in the live course a lot is I thought that the more I talked to patients about complications, the less they would do treatment with me. And it was the exact opposite. It's kind of like what you said, people said, oh, don't train GPs because then you'll get less referrals. And it was the opposite. It was the same with me with patients, don't talk about complications because then they won't do it. It was the exact opposite. I think they realized, oh, this is another human. And we connected on a human to human level instead of a doctor to patient level. And I think bringing us doctors down, because we're respected in our communities, right? You bring us down to human level and you can have that human to human connection. And these are the patients that refer their whole family, refer everybody, are always talking about this. And I also liked that when I had these communications up front, if something were to happen, the patient called and said, oh yeah, Dr. Stanley, I know you said that the crown may fall out. It did fall out actually. So, I'm going to come in and we can put it back in, right? Oh yeah, no problem. Instead of, you don't know what you're doing, or I want my money back, or I'm going to sue you. It changed the patient's mindset by having that good communication.
Yeah.
So
that was great. That was great to see in the light side course, to get to know Dr. Kyle Stanley and see how you manage at the top level. You have patients that are very picky, very demanding, what we call difficult patients. So management is extremely hard. So I picked many things from your videos, the streaming videos, from the live sessions, where I'm like, hey, this is good. I'm going to try that. So that was very helpful to me.
Thank you. Yeah. And on that similar topic, what was maybe the biggest takeaway from the course that you got?
Okay, there were many things that I got. The number one thing that I got was to see that no matter where you are in the world, and or wherever you're at in your growth journey, you're going to have these things. So I got to know other people that have similar issues by sharing story. That's it created some release and just a feeling of ease that I'm not the only one dealing with these stressors myself.
Yeah.
Second, I learned some tools, some strategic tools about mindset. For example, the inner self, the only person that you have that has control over it is you. Okay, so yet we see a lot of people, talking so badly about themselves and calling themselves stupid and an idiot and incompetent, even if it's not said verbally, it's the thought. And when you talk with patients, that's one of the things I got from the course. When you talk to patients, they don't have power over you. they may say whatever they want, whether it's the patient's fault or my fault or, you know, the universe's fault. Nobody has the power over you but yourself. Nobody can control how you feel inside. That's the power that only you have. And if you can control it, you'll be in a better place. So if a patient comes back with a complication, whether they're cool about it or not cool about it, it doesn't affect me. It doesn't affect me. Even if it was my fault, it doesn't affect me because I accept myself as imperfect and as a human, as human. I'm not a god. I'm not an immortal person that is just, you know, can do whatever they want. And there was a great mind hack that I learned in the course to tap into that part.
Yeah. Yeah, no, thank you very much. And that was something that I wasn't trained in. And, you know, I was trained that we're doctors and we do the best. And, you know, in dental school, I think you don't have enough time to deal with complications. You're not, you know, your patients are, even if you treat your patients junior year, right? You've got a year for things to go wrong. It's usually the people after you that treat your complications. And, you know, you get into clinical practice and you have patients that are, you know, 5, 10 years. I've been out 11 years. And that's when you really start to see what works, what doesn't work, how you have complications with things. I mean, I have some cases, I mean, you're like me in that you take a lot of photos. I have some cases that I'm taking pictures and I'm like, I'm going to show this at, you know, AO, I'm going to show this at some big symposium. And that turns out to be the one that has the biggest complications. And, you know, actually, I'm glad I take those photos because those are the ones that actually I can teach more. You know, people learn more from me failing, not from me succeeding. But just knowing that I am imperfect was a very difficult thing for me to realize, because as dentists, we're overachievers. You know, we succeed in high school to go to college, we succeed in college and on our DATs to get into dental school, and you have to work hard at dental school to graduate. So not a lot of us have these failures. And then you get into something where, you know, we've never been a business owner. We've been learning dentistry for the last 8, 10 years. And now we're a business owner. And now not only am I failing in my complications, my clinical complications, but my communication complications with my team members or with my colleagues or with my landlord or whatever it may be. So yeah, really good insight. So lastly, I would say, what advice do you have for any dentist out there, but especially maybe for those young dentists that haven't maybe been through it yet?
Wow. The advice I would give myself, you know, just let's say I graduated, you know, 22 years ago, would be, you know, Ziv, it's all going to be okay. It's just a work in progress. Just keep moving forward and move through those challenging times, because once you pass one challenge, another challenge would come again. So first thing is, you know, expect those bumps to happen, you know, during your journey, and they keep happening almost every day, actually.
Yeah.
So the thing is, we need better tools. We need better tools. So if I had to go back, I would start my self-development or self-improvement process earlier on in the game, not when I'm 38. I would start in my 20s, but at 20, you think you're the king of the world or queen of the world, you know, whatever you perceive yourself. And you don't have the maturity to think, you know what, there's actually much more. Actually, my parents were right when they said, you know, go this way. So we don't have the maturity. But if I had, I would start my you know, inner my introspection sooner. I would read those books sooner. A book that comes to mind is the book Tools by Phil Stutz. I may have mentioned it before. I'm getting
Yeah,
senior.
I've seen the cover before, but I haven't read it.
Incredible. And Phil happens to be also somebody I know personally, so I had the
Oh, cool.
luxury to talk to him about the book.
Mm-hmm.
It gives you practical tools to deal with things that we all deal with. And it's okay to struggle, and it's okay to feel anxious. when we get into dental school, it's not a coincidence that the kids in dental school, they're all kind of the same, whether they're, Jewish, Asian, white, black, they're kind of the same kids in their mindset. They're very scared. They're very scared. And they're very self-critical and they're very OCD, including myself, very
Yes.
perfectionist,
Mhm.
and kind of depressed a little bit because, you always compare yourself. It's kind of starts there.
Yeah.
And that's where dental school should give us more tools to deal with that, especially when we come, we were born into the world, we're thrown into the world of dentistry, which is a jungle, especially here in Beverly Hills. And you fight and climb up, up the food chain.
Yeah.
So yeah, so start your self introspection first, immediately. There's tons of resources out there. There's tons of seminars. I'm a big fan of Tony Robbins. Some people see him as like a guru. This stuff, this shit actually works.
Yeah.
Psychological inner game works extremely well. And I wish I'd started 15, 20 years before I started my journey. But I don't regret it. Maybe I needed some of those experiences to compare. So I don't have the regret, but that's what I would. This is the most important thing. And also the other advice I would give a young dentist or a young professional in general: get financially educated. I was clueless. When I say clueless, and I thought I knew something compared to what I know today. Get educated about finances, what credit really means, what is a loan. This is invaluable. Get a financial advisor. I know it's hard to even think you need one. Why would you need a financial advisor when you're like 30 years old, 25 years old?
Right.
You know what? You don't need to get like Harvard trained financial. You need somebody to guide you through this maze and start saving for retirement.
Mhm.
Don't buy the fancy objects when you can't afford them. When you can
Right.
afford them, okay, then you have an option. That's awesome. That's a beautiful perk of being a high-end professional. But get educated financially.
Yep.
That's what I
Both of those really speak to me for sure. I remember seeing someone had a Tony Robbins tape, like a tape in their car when I was maybe in high school. And I knew who he was. And I said, like, this poor person, they are just weak. They just
Yep.
they just can't handle it. And I was that hypocrite that I looked at people that had anxiety or depression or difficult times as weak. And then guess what? I was that person. I was that person that had anxiety and that had depression. And what I realized was, I needed to think about this earlier. And just because you're going through a hard time, it doesn't mean that you're weak. It means that you're human. I just hadn't gone through it yet. And that was why I started this course, was because I wanted to give, I had to kind of, like you said, climb way out of the depression myself. I didn't have the tools. I didn't have other dentists that were talking about this. And I didn't want anybody to have to go through that. So I wanted to give the tools that I learned in my, my valley of despair, so that people didn't have to go through it, and make it easy and understandable. So I totally agree with that first one that you're saying. Thinking of that, analyzing yourself earlier in your life. And I think my problem in my life was that I had too big of an ego growing up, because I had never really failed. I played high level of sports. I did pretty well in school. Most things that I tried, I didn't totally fail at. And then you get into dentistry, a profession like dentistry that is just so vast and so wide and so difficult in a psychological standpoint. Not only the clinical part, but you're working, 3 inches from someone's mouth. And like you said, they have to pay. It's expensive and it's time consuming, and they don't want to do it, and it may be painful or uncomfortable. Yeah. And then that financial part, I've always said, if I make it big, like if I hit the jackpot somewhere and I am just loaded and I don't have to work, I would love to do a life course for people in high school. I'd love to teach them how to public speak. I'd love to teach them about finances, like you're saying, interpersonal relationships, how to change a tire, all these things that I felt like, I mean, I knew how to change a tire just because I was into cars, but all these other aspects that have been so important in my life that I didn't know early on, I would love to be able to teach that to young adults. So last question, and it's a little bit of a self-serving question. What advice would you give, or what would you say to someone that's thinking about taking a course like this? Thinking about, I see this light side course. I don't know if I need something like this. What would be your advice for them?
Light side course, if you're thinking about it, take it right away, because the fact that you're thinking about it means you need it, and we all need it. This is a must course for every dentist at any level, at any age. I strongly recommend doctors start taking this course before they even get the license, because the course has the streaming component that you can review. That in itself is just a trigger to see what of that applies to you, pretty much everything, but it will start making you think, what are the things that you're about to experience. You're just being thrown into the world of dentistry, and you will have those stressors. This is what the course just triggers. Plus, you're getting the community of people like you. By the way, dentists that gravitate towards the light side course are all like-minded. They're all nice people. There are no a-holes. There's no, they're all no meanies allowed. But it's almost like self-selection, because it will self-select to people that want to be better, that are humble, and are just like you. So it's a must course for every dentist. It's I would like to say it's affordable, so any dentist can afford it at any stage of their career. It's a great investment. And if it helps you with at least one thing, like myself, I picked up a lot of things from it already. I feel that my inner game is pretty strong. I teach it actually myself. I have my own courses.
Yeah, I would agree. Your inner game is strong.
But I picked up a lot of things myself. And even if you feel that you're all that, take the course and see that you're along the lines, because dentistry could be a slippery slope. We have the tendency as dentists to suppress our emotions and keep all this angst, fear, depression suppressed inside. Why? Because what Kyle said before, it's a sign of weakness. We cannot show weakness because we are all that. We are these, we're dentists, we're doctors. We have to stay composed for our patients, for our staff, or family members. What does it do? It just eats you from the inside. And like I said before, nobody has power over you except for yourself. You're the only person that can control how you feel. And in some ways, this course releases some of these emotions. Some people call it therapy. By the way, much cheaper than therapy. Being a good customer for many years, you cannot get through therapy for $500. So
yeah,
strongly recommended, Kyle, and I commend you for doing this. This is selfless. This is a contribution to a fellow dentist that is in suffering, and there's no better way to help a person by sharing your own experience with transparency, with honesty, and I strongly recommend it. So thank you for creating it.
Well, thank you so much for the kind words. Like you said, you were at a good point really when you took this course, but you still got to learn something. And that's actually what I find with giving the course. When I started the course, I was kind of like, I went through my hard time, I'm learning more, but it's funny how every session that we have, I'm writing stuff down that, our participants are saying. They're sharing stories about how they talk to patients or how they deal with complications. And, I'm learning more and more and more. So the good thing about that is that I'm able to grow as a person, but also as a mentor for other people who may take the course, and for younger doctors, I'm able to learn and constantly keep evolving. So yeah, I learned just as much, and you know this from being on the podium so much, is you learn so much by teaching. And that was what I wasn't expecting. You know, I knew that was, I knew that over teaching clinical dentistry over the last 10 years, but I didn't think that I was going to keep learning on the mental side. So Ziv, this has been awesome. I don't want to take up too much of your time. I know you're very busy. You're at your practice, so thank you again for taking the time. I also just want to thank you for, you know, being my friend over the last decade or so. And you know, I'm proud to call you my friend, and I'm proud of everything you've done doing quality dentistry. You know, in Beverly Hills, we have the best and the worst of dentistry, I think, like in most big cities. And you know, I consider you one of the most honest, straightforward doctors in our city. So thank you for everything you do. And for those that haven't seen Surgical Master, I've taken some of their courses before. I've watched them on the webinars, and they're super easy, very easy to understand. There's a lot of online courses, YouTube videos that I've watched. I listen to your YouTube videos when I'm driving oftentimes. So thanks, Ib, for taking the time, and I look forward to talking to you soon.
Thank you, Kyle. You're a great friend for all these years. I look up to you. I saw some spark in you when we first met, and we went to this restaurant that doesn't exist anymore.
Yes.
Many moons ago. And I always knew that you're going to be successful, not because your you know, clinical skills only that are superb, and your, you know, your drive. It's just a personal thing. You know, we just want to be successful, and it's just what drives us. And I saw this in you early on, and that's why I felt comfortable giving you the insider tips. One more tip, by the way, that is very important beyond what I said before, is stay physically fit.
Yeah.
Stay physically fit at the highest level that you can within your body. I mean, if I wanted to be the Iron Man, I couldn't, because I just, you would kill me, meaning I would ruin my body. But get to the maximum of that, because you'll need it, not just to go through the grueling practice of dentistry, but for your mindset. More than that, you gotta be physically active and super fit, mindset of an Olympic athlete if you can. And keep learning. Definitely take the light side course with Dr. Kyle Stanley. It's a must. I think you even have a guarantee. You know, if you didn't like it, you know, you get your money back, which, and you will not ask for your money back, because it's so valuable.
Yeah.
So
thank you so much. And for those of you thinking about the course, it's open for 3 more days. So 3 more days, and then we shut down until September. So get in now, or we'll see you later in the year. Ziv, thanks so much.
Take care.
And talk to you soon, buddy.
Take care, man. Bye-bye.
All right, bye-bye.